I knew what leukemia was, but I think I was just in shock at the time. But when you're living it, it's a whole new thing. I mean, it's a whole new meaning.
The doctor's office called and told my family to go to Hershey Medical Center and to pack an overnight bag.
Our life was changed dramatically in that fraction of a second.
And you thank God that you have a Penn State Hershey Medical Center that is right down the street.
So being located here in central Pennsylvania makes a big difference for both the child's outcome as well as for the family to have access in their own neighborhood or in their own backyard.
The physicians and staff here at Penn State Hershey Children's Hospital are entirely dedicated to the health of the child and to integrating the family into the care that that child receives.
Last year, over 95,000 children came to us for care in both our inpatient and outpatient facilities. Our goal is not only to take care of children and their families, but really to be part of the healing process.
26 days she was in isolation, and we would go back and forth every 3 or 4 days. Only one parent could be in there with her.
Everyone in that hospital that's been a part of this, I mean, everybody just there was so supportive of what you're going through.
At the time of diagnosis, I really didn't know what leukemia was. The first thing I knew about it was that I was going to lose my hair. But based on the reaction of my family, I knew that it was something serious.
He was just going to die in my arms. So my thought was, when he goes to heaven, I just wanted to talk to him. And I just wanted him to know that he wasn't alone.
They made us feel like Gavin was so important to them, which I think he was. They treated us, I don't know, with such respect. They care so much about you, and they do everything to make you feel at ease or get you through the situation.
From the minute we walked into the hospital, they made us feel as comfortable as possible when we were terrified. With the outstanding care that the Children's Hospital already offers, imagine what it'd be like if there was a building just dedicated to pediatric care.
We're all passionate about the need to have a brand new freestanding Children's Hospital building so that the kids here in central Pennsylvania have the same state-of-the-art facilities as you'll find in many large metropolitan areas across the United States.
Some of our physical facilities don't enable us to deliver the type of family-centered care that we'd like to be able to deliver.
The quality of care is excellent. Our pediatric intensive care unit ranks first nationally in at least one quality measure. At the same time, there's not enough room. We're actually bursting at the seams. It's not the environment that we'd really like to focus on for family-centered care.
The needs and the growth of this community just requires so much more.
The new building will have space on the first floor, which is really family focused. We really don't have enough of that right now.
We want every child, every family to have their own room.
The larger rooms will definitely accommodate the ability for a parent to stay in the room.
We have to be environmentally conscious also, and I think the new building, being a green building, is going to advance that principle in the marketplace.
It really takes that opportunity for us to envelop the philosophy that the community is important.
It's going to bring tremendous care to the children of central Pennsylvania. It's going to be an institution that I think will attract premier pediatricians and specialists and students to the area. It'll attract researchers to the area.
We're able to take research discoveries from the laboratory bench and bring them to the patient bedside.
We'll take all that success that we've had and be able to utilize a new building, state-of-the-art family-centered care, and really deliver a level of excellence beyond what we've already been recognized for nationally.
It is a dream of so many, for so many years, that there's a facility like this and it be located at Penn State Hershey Medical Center.
She's back in school.
She's
she's kind of getting back into normal activities. Yeah. She's really happy to be there, to be back. I really would love to one day see that separate children's hospital there.
My freshman year of college, I celebrated my 5 years off treatment, which means that I'm technically cured. All of the doctors and nurses that I've met will forever leave an impact on my life.
When it hit that 11th day and he woke up, that was a miracle.
Nothing has changed. He's the same boy that he was before the accident.
You're 7.
We bring Gavin back to the pediatric ICU so they can see him and see how well he's doing. And he wouldn't be here. Gavin would not be here. We would not have our Gavin Gilhole. We would have a memory.
We have a need for a freestanding children's hospital to provide the kind of quality care that we expect as we look ahead in the decades to come.
We're putting our children ahead of everything else when it comes to philanthropy, and I can't think of a more important goal than making sure that our children have state-of-the-art healthcare services.
We need to make it happen. It has to happen. That the Children's Hospital has to become a reality for all the communities that it serves.
Nothing ever stands still. You either go forward or you go backwards. This is a way to go forward, and that is essential.
If you really think about the future of our state, it's important for us to embrace those things that provide the best outcome for children. And that's why we need a new children's hospital in central Pennsylvania.
Philanthropy is a key element of what will make this children's hospital happen. So I encourage people to be as generous as they possibly can to help Penn State make this a reality.
These people have donated money prior to my son getting to the ICU. They saved our life.
They don't know. They don't know who they're helping, but they're helping families like us that never thought we would need it.
It is now time to build a freestanding facility addressed to the issue of kids and have the absolute best that this area of Pennsylvania can offer. I mean, that is the Penn State way, and the time is now.